Have you ever wondered if there's mold in your home or the places you frequent, like your work? For those of us that know anything about mold, you've likely heard of black mold, where you can visibly see it in water-damaged buildings and things like that. But what if you don't see the mold? Could it still be there? And more importantly, could it be making you sick? Well, the unfortunate truth is that yes, this invisible mold too can very much make you sick. And the other interesting thing about this is it doesn't affect us all the same way. So just because your roommates or partner that you live with aren't also sick doesn't actually rule out mold. And this is a very common story I find for a lot of my patients who finally get that diagnosis, is they were chasing the wrong things, convincing themselves that mold wasn't part of the problem. It wasn't the reason they were getting sick because no one else in the household was sick. And unfortunately, it's just due to genetic differences and different health states that will make someone more vulnerable or not. But let me assure you, it is not good for any of us. So before I jump into this topic, I want to first introduce myself and then we'll get into whether or not mold is making you sick, what that looks like, and the testing associated with it. So I am Dr. Robin Lewis. I'm a naturopathic physician practicing here in Vancouver, British Columbia, Canada, and let's jump into it. The first thing that I want you to realize is that mold is a much bigger problem than most people think. It's estimated that at least 25% of the homes in North America have mold within them. And I actually think that's a pretty conservative number, but to be fair, it's really hard to find exact data on this. But just know that a lot of homes have this. And interestingly enough, it's not just those older homes, basement suite kind of situations. In fact, they're finding mold is more easily built up in a lot of these new builds due to the material that we're using. A lot of these synthetic materials are a lot easier to decompose, so they attract more mold. We're not building things out of good lumber like we used to, like oak and teak, that are mold resistant. It's just too costly. These new builds are not using that kind of material, and because of it, they are more easily able to attract and grow mold. The other very interesting thing is you can see mold in counterintuitive places. So yes, generally speaking, mold loves moisture. So you'd expect it somewhere like where I live, which is Vancouver. It's very moist in the air. Therefore, we do see a lot of mold inside of our homes. But due to things like air conditioning, there can be a mold buildup in drier places. So the condensation that builds up inside of these AC units can harbor mold. And if you live somewhere where you're running the AC constantly, say like Arizona or Nevada, this is where you can start to see mold in counterintuitive places, the dry places as well. So are you getting the picture? It's very, very common. So really, this can affect anyone in any home. But one concept I do want you to understand is it's not just merely the presence of mold that is the problem. It's the airborne toxins that these mold release called mycotoxins. So these molds will release their mycotoxins into the air in order to defend their territory. Kind of like how a skunk will spray you to get you to go away. These mycotoxins will do the same thing, you just don't see it. And it's the mycotoxins that are often most related to mold illness. These are the things that make people really, really sick. So the mold inside your home can release these mycotoxins. The mold that inhabits you can release these mycotoxins. So sometimes, if you're unlucky, the mold can start to colonize your sinuses, your gut microbiome. Essentially, it integrates itself into these microbiomes of these different areas. And when it releases mycotoxins there, it's in a way poisoning you from the inside out. I know it's a freaky concept, but it does happen. And so when this does happen, it can make people very, very sick. And this is why I made this video, because I want you guys to be able to understand how mold could be affecting you, what symptoms to look out for, and how to get the answer of whether or not this is actually affecting you. I've seen way too many people chasing the wrong things, going down every other avenue to explain why they feel the way that they feel, when really it was mold all along. This isn't a topic that is discussed a lot in conventional medicine, and we will go over some of the testing that can be confusing here, but I just want this information out there for those of you who are suffering, because a lot of the times it takes a super long time to get to this place where you find the answers. And once you realize what's causing your symptoms, you can come up with more targeted therapies to go after those symptoms. So hopefully I can do that for you today. In healthcare, we call mold one of the great mimickers, which means that it can look like a lot of other conditions. So oftentimes, these people will be slapped with a bunch of other diagnoses, like generalized anxiety, chronic fatigue, fibromyalgia, chronic sinusitis, IBS, neurodegenerative disease, and so on. The point is, it can affect many different systems. And so I will provide you a list here of the different type of symptoms. Just note, it's not a complete list. This can go on forever. But one thing you should notice is that it can affect many different systems. And that's one of the problems with mold and getting a mold diagnosis, is it can look different depending on the person, and it can affect many different systems. And so I'm going to highlight for you today a couple of these symptoms and how mold is triggering those, just to give you an overall concept of how this is working. I won't have time to go over every single symptom because it is very long-winded. But if we look at a couple, you'll begin to understand just how mold could be doing so many different things inside the body. Let's start by talking about the fact that mold will inflame your brain, your peripheral nerves, your gut, your skin, and so on. If we talk about nerves, it has been shown to have a negative effect specifically on our vagal nerve, which is very important for a lot of different things inside of the body. But one of the things that the vagal nerve will do is it'll communicate from your gut to your brain. So it's that gut-brain connection that a lot of us holistic doctors love to talk about. It's communication through that vagus nerve. Now, of course, if mold can start to colonize your gut and negatively affect your gut microbiome, your vagus nerve is going to sense that, communicate back up to the brain, and this is how it can lead to things like depression and anxiety. Now, of course, many things can create anxiety, but this would be the type of anxiety that isn't just purely situational. Some people will describe it as kind of like a buzzing inside of their body, maybe not a true anxiety. Or better yet, for some people, it's when I go into my home or wherever the mold resides, my anxiety spikes. Now, not everyone gets that obvious of an association, but these are little cues to say that maybe mold is part of the problem. And in fact, anxiety is probably one of the most pervasive symptoms associated with mold. The other thing to think about is, where does this mold like to live? So as I mentioned before, it loves to live in your nasal passages, your sinuses, your gut. So of course, you're going to get symptoms associated with those areas like congestion, sinus issues like infections, things like that, diarrhea, constipation, abdominal pain. So a lot of the symptoms can be associated with where the mold is. And then lastly, one of the other things that these mycotoxins are very notorious for is damaging your mitochondria, which we have coined as the powerhouse of your cell. In fact, I did a whole episode dedicated to just this. It's actually my #1 episode. The mitochondria is massively important, super cool. But this is where you will start to see people really fitting that fatigue picture and brain fog picture. Now, of course, the mitochondria is kind of used for everything inside of the body, but it's where we manufacture energy. So the most obvious symptoms associated with a damaged mitochondria, a poorly functioning mitochondria, would be like feeling you don't have any energy. You're exhausted all the time. You feel like you can't pull up thoughts and memories. You're cognitively slow. These are very common symptoms associated with mold. And then, of course, there's a whole variety of other things depending on which mycotoxins you have. So there are many different types. Some are more toxic to different parts of our bodies, and some are more severe than others. So it can be quite a spectrum of people having mild discomforts all the way to things like cancers, neurodegenerative diseases, really severe manifestations of the mold toxicity. Now, I'll have to refrain from going on and on about all the different ways mold can negatively affect you, because this would be an incredibly long episode. It would be quite boring and repetitive. But the point is that there are a lot of different symptoms that can be caused by the mycotoxins that are released from that mold. So then the bigger question is, how do you find out if that is causing your discomfort, your health concerns, and the decline of your overall well-being? So that's where testing is coming in. Now, I'm going to start by talking about the test that is most often ordered, yet has the least to do with mold-related illness, ironically. And that is mold allergy testing. So this is kind of like looking at it like it's an environmental allergy, kind of how you are allergic to certain pollens during certain times of the year. So a lot of doctors are familiarized with this type of mold testing, where they'll look at markers of IgE, which is a type of immune reaction associated with allergies, seasonal allergies. So they'll often do this through either a serum, aka a blood IgE test, or a scratch test, which you see done in a lot of allergist testing offices. And these techniques are very well standardized. They're a part of our conventional medical system. And so if you talk to the right doctor, you can get a mold allergy test done. But as I said before, this often isn't the type of test I'm looking at when I'm referring to people who have mold-related illness. This is more of an allergy situation. So it would present more like seasonal allergies. You'd get the runny nose, watery eyes, itchy skin, sneezing, coughing, things like that. It is very much going to present like any other seasonal allergy might. But this isn't the type of reaction that's going to lead to these more severe manifestations like debilitating fatigue, pain, migraines, degeneration of your nervous system. That isn't caused by a mold allergy. The good news is we do have means to test those things as well. So let's jump into urine mycotoxin testing. So this is where you can detect the top 16 or so mycotoxins in the urine. I will say this is not typically part of our public healthcare system. This is usually a private pay test, and so it's not something that you will often see a random GP ordering. It's just not built into the system. So keep that in mind. But if we look at the urine, we can see our body excreting these mycotoxins. Now, of course, we are exposed to a certain level of these in a day-to-day basis, say like the mold on our food and stuff like that. But what it's looking at is if you exceed the normal threshold of what is normally in your environment, and you're producing or excreting a lot more than that, that suggests that you're having a higher than normal exposure of whatever that particular mycotoxin is. And if we can identify the type of mycotoxin, we can A, extrapolate where it's likely coming from, and B, be very targeted about treatment, because each of these mycotoxins are associated with certain symptoms and certain damages inside of the body. So we can kind of go after that particular mechanism. And they also will respond to certain therapies, aka how do you get it out? Although the big thing to note about this type of testing is that mycotoxins can store inside the body in places like your fat and your nervous system. So when you get a higher than normal reading on these urine tests, it could be from a past exposure or a present exposure. It doesn't really extrapolate when the exposure was happening. It just tells you how bad it is and what to chase. And so this is where we get into testing the home. I am by no stretch an expert on home testing. My type of testing focuses more on the human body. So I won't go into great detail on this because I really am not an expert in this field. But it is crucial that if you show up high on these tests that you need to get your home tested. We need to figure out if you are still being exposed to this toxic mold. And if you are, it makes therapy really, really challenging. I cannot completely resolve your issues if you're constantly getting inundated with more mycotoxins. So this is a very important part of the puzzle. What I do know, however, is that there's two main types of testing. There's testing for spores, so looking at the actual mold itself, and then there's testing for the mycotoxins within the home. In both scenarios, they're collecting dust swabs off of surfaces in various different parts of the home that are most likely to accumulate these things. So knowing where to collect is also an important part of the equation. And whether or not you're looking at spores or mycotoxins, in a perfect situation, ideally both. But I will say these at-home kits are very hit or miss, and sometimes there's an accessibility issue. So some of the tests that I like to do with my patients are ordered through these labs. So there's kind of a gatekeeper. There's me, the doctor, who has to give you the kit. And for some people, that is just not a accessible option. And so this is where going to these mold remediation companies can be really helpful because that is the bread and butter of what they do. And you can get a very accurate assessment if you do the right type of testing. And so that's really all that I'll say about it because it's not an area of my expertise, but just know that it's very important to test your home. So circling back to some of the testing that applies to the human body, let's look at organic acid testing, which is often also a urine test ordered by people like myself, a naturopathic doctor, a functional medicine doctor, usually someone who works more in the private healthcare sector. And organic acid testing can be used for a lot of different things. It's not just mold-related illness that it's looking at. It can look at a lot of different metabolic functions and stuff like that. But if we talk about it in the context of mold, it's going to help you identify whether or not mold has had a chance to colonize you, aka set up shop in your sinuses or in your gut, things like that. And I'm not even going to try to pronounce some of these markers. I will list them for you, but they're very hard words to say. And these are some of the markers that I'm used to seeing on these organic acid tests that will roughly tell you whether or not you're colonized by things like Aspergillus, Penicillium, and Candida, which Candida can be kind of its own separate thing. It's a type of yeast that is a very common overgrowth inside the gut. So it can be related to these other molds, but I wouldn't say it's the kind of thing that's leading to these more severe manifestations of mold-related illness. So that's the only one thing that I will caveat. There can be a Candida picture, and it doesn't necessarily mean you have mold-related illness. But if you have some of the other markers that are more associated with Penicillium or Aspergillus, then that is more likely related to some of these mold-related illnesses and the mycotoxins that they produce. And just quickly, because I didn't mention it earlier, there are 4 main categories of mycotoxins that the urine mycotoxin test will look at. This organic acid test does not look at these things. So it can be actually very helpful to have both. The mycotoxins will typically fall under the category of Aspergillus, Penicillium, Tachybotrys, or Fusarium. And then within those are their own set of mycotoxins with things like ochratoxin being a specific mycotoxin underneath those umbrellas. And interestingly enough, just quickly, the Tachybotrys is the one that is most often associated with black mold. So there are many different types of mold. It's not just black mold. And these mycotoxins will identify which of those problems you have or what you've been exposed to. The last type of testing that I want to mention is serum antibody testing. So this would be looking at things like IgG or IgE, which I've already mentioned the IgE as part of the allergy. And if they're looking at IgG, that's another immune reaction to these mycotoxins. I will say I don't use a ton of this, so I really can't speak firsthand to the benefit of this type of testing. It's not something I was trained in when I was looking at how to address mold-related illnesses. The one thing I will say that I do know can be a limitation of these types of tests is the fact that mold loves to suppress your immune system, especially if you've had this problem for a long time, if you are one of those more severe cases. And so your immune system has to mount a reaction in order to show up on these tests. And so if you have an extremely weakened immune system, you may still have the problem, but the antibodies won't show up as elevated on your test because you just don't have the immune capacity to raise those numbers to the point where they get flagged. So that's the only thing I'll really say on that type of testing. It's not one of my keystone types of tests. And this really highlights just how complicated this can be, right? You might see that test, see a negative result, and be like, no mold-related illness. So these sort of tests always should be done in conjunction with a doctor who knows what they're doing. Because when you do show up positive for these things, it is not an easy solution. It is quite a journey to heal from mold-related illness. The road can be extremely bumpy with lots of ups and downs. And having an experienced practitioner who knows what those ups and downs look like, how to circumnavigate these things is extremely important because you can recover, but it will take some time and it will take an expert who knows what they're doing, how to address mold, how to clean up the collateral damage associated with mold, and prevent you from getting the same issue over and over again. I hope that you found today helpful. I know this was, as always, a very condensed, short version of what it could have been. If you have any questions related to mold-related illness and how to figure out if you have it, please comment those below. And yes, I do plan on doing a future episode more geared towards the treatments associated with mold-related illnesses and those mycotoxins, but that was not the point of today. So thank you again for listening. Have a wonderful day, and I look forward to seeing you again.